hematopoietic stem cell transplantation, except CML is an exception where tyrosine kinase inhibitors are so effective that for CML, treatment of choice is considered to be tyrosine kinase inhibitors like imatinib. Otherwise, for most of the leukemias, it is hematopoietic stem cell transplantation which is considered as the treatment of choice or the definitive treatment. तो यहाँ पे patient में hematopoietic stem cell transplant करना prophylactic radiation was given. And why usually radiation is given in cases of lymphocytic or lymphoblastic leukemia and not in cases of myeloid or myelocytic leukemia? If they are arising from lymphocytes, we will give radiotherapy. We do not use radiotherapy if the malignancy is arising from myeloid lineage or the myeloid cells. Reason is which are the most radiosensitive blood cells? Anybody? Which are the most radiosensitive blood cells? Straight one line now. अरे किसमें यूज कर रहे हो तुम? किसमें यूज कर रहे हो? कौन से ल्यूकीमिया में? लिम्फोसाइट ना? So most radiosensitive blood cells will be lymphocytes, right? So the most radiosensitive blood cells are lymphocytes. The cancer arising from the lymphocytes can be treated with radiotherapy effectively. Okay, whether it is a lymphoblastic or a lymphocytic leukemia, or it is a Hodgkin's or a non-Hodgkin's lymphoma. Okay, here we can use radiotherapy easily. If they ask you which is the most radio-resistant, then what should be your answer? The most radio-resistant blood cell. क्या हो रहा है? Anybody online? The most radio-resistant blood cells. What is your answer? Straight one liner सही है. इसमें कोई सोचने की जरूरत नहीं होती. Lymphocytes तो हो गया ना? They are most radiosensitive. It is the platelets which are most radio-resistant. What do I mean by these two terms? Radio-sensitive मतलब which will respond to radiation. Radio-resistant मतलब जो radiation को भाव नहीं देंगे. In short terms, you need to remember this. Please remember. So therefore, most radiosensitive blood cells are lymphocytes, whereas most radioresistant are platelets. So therefore, the patient was given a prophylactic irradiation. Which of the following will be the least affected by radiation? If I talk about tissues or cells now, not only blood cells, but rather I'm talking about tissues or cells in whole body, then what is your answer for this? Which will be least affected? Most least affected matlab radio sensitive or radio resistant? The most radio resistant I'm trying to ask you. And what is the answer? So yaad rakhna, radiation is directly proportional. You can say radiation effect is directly proportional to cell division. What do I mean by this? जिस टिश्यू में सेल डिवीजन ज्यादा, उस टिश्यू में रेडिएशन का इफेक्ट ज्यादा पड़ेगा. Now, which are the cells which are constantly dividing and redividing? So, very good. So, if I talk about the cells, okay, so it is the germ cells. Okay, if I talk about the cells, it will be the germ cells which are constantly dividing. Therefore, germ cells will be most radiosensitive or radioresistant. So, they will be the most radiosensitive cells, right? Germ cells which are present in your gonads, that is your testis or ovaries. जो germinal epithelium होता है या germ cell होता है, that is rapidly dividing and constantly dividing. Menses हर महीने होता है ना, sperms हर बार बनता है ना, so that means they are constantly dividing, and if they are constantly dividing, therefore they are at a higher chance of radiation effect. Okay, उस पर सबसे ज्यादा effect पड़ेगा. अगर वो tissue पूछे तो, if they ask you the tissue, then it is your bone marrow. The most radio sensitive tissue, if they ask you, then your answer should be bone marrow, because in bone marrow we have which kind of cells? We have the hematopoietic stem cells. And what is the property of these hematopoietic stem cells? They are again rapidly dividing every time because blood cell production does not stop. ठीक है? तो इसीलिए these are the most affected tissue. But most affected cells अगर पूछते हैं, then answer is germ cells. Whereas if they ask you किन में फर्क नहीं पड़ेगा बिल्कुल भी, the most radio resistant cells, the ones which will never divide. Okay, these are usually called as stable cells. Stable cells are the ones which will never divide, and the ones which never divide are called as your neurons. इसीलिए बोला जाता है ना कि once the neurons are damaged, it cannot be regenerated again. ठीक है? So that's the reason why here you answer which among the following cells will be least affected by radiation? Answer will be neurons, because it has least amount of cell division. That's the basic idea. उनमें सबसे कम cell division होता है. These are stable cells. ठीक है? So germ cells, bone marrow, followed by epithelium or mucosa. कौन सा mucosa फिर? GIT and respiratory mucosa, or even the genitourinary mucosa. But अगर वो पूछते most radio resistant organ in the body, most radio resistant organ अगर पूछे तो वो तो सेंसिटिव हो जाएगा ना यार. मोस्ट रेडियो सेंसिटिव ऑर्गन विल बी गोनाड्स. ऑर्गन्स की बात करेंगे हम. हर एक क्वेश्चन अलग है, याद रख लो. मोस्ट रेडियो सेंसिटिव सेल्स, जर्म सेल्स. मोस्ट रेडियो सेंसिटिव टिश्यू, बोन मैरो. मोस्ट रेडियो सेंसिटिव ऑर्गन, गोनाड्स. ठीक है, रिमेंबर गोनाड्स इज ओवरीज एंड टेस्टिस बोथ. हाँ, याद रख लो, ओवरीज आर रेडियो सेंसिटिव, बट जो ओवेरियन कैंसर्स होते हैं दे आर रेडियो रेजिस्टेंट एक्सेप्ट डिसजर्मिनोमा. ठीक है, याद रख लो, ऑल ओवेरियन कैंसर्स आर रेडियो रेजिस्टेंट. दो ओवरीज की अगर मैं बात करूं अकेले, तो ओवरीज आर रेडियो सेंसिटिव. ओके, उनको उनके ऊपर अफेक्ट होगा. बट अगर किसी पेशेंट में ओवेरियन कैंसर हो जाता है, विल इट रिस्पॉन्ड टू रेडिएशन? देन नो. ठीक है, तो ओवरीज आर रेडियो सेंसिटिव बट ओवेरियन कैंसर्स आर रेडियो रेजिस्टेंट एक्सेप्ट वन ओवेरियन कैंसर वेयर रेडिएशन कैन बी यूज्ड. आंसर इज डिसजर्मिनोमा. उसमें क्लियर है, कोई दिक्कत नहीं अभी. दैट्स द इंपॉर्टेंट थिंग. ठीक है, whereas if I ask you most radio resistant organ, what is your answer? The most radio resistant organ is vagina. Please remember, the most radio resistant organ is vagina usually. ठीक है, then talking about the question number 2 now. It says a patient following a road traffic accident was brought to the emergency room 2 hours later. On examination, the GCS, Glasgow Coma Score of this patient, is 15 on 15. Okay, pupils are reactive. Pupil plus means pupils are reacting to light. Tenderness is there. What is tenderness? Pain on touching. There is tenderness and there is bruising. Bruising is nothing but bleeding which is seen over the left lower chest of this patient. Severe tenderness. Okay, there was severe tenderness elicited in the left hypochondriac region. Which is the left hypochondriac region? I hope all of you are quite aware. We are going to start surgery any which ways. So this is the left hypochondriac region. ठीक है, तो यहाँ पे उसको severe tenderness था. Blood pressure of this patient is around 90 by 50 millimeters of mercury. What is the best investigation used in the emergency room? Now, एक important thing है. Definitely यहाँ पे the patient has not sustained any head injury. Why? Because the patient GCS looks normal and the pupils are also reactive. So we are not suspecting any head trauma in this patient. What we are suspecting is usually abdominal trauma. Though the patient is having bruising over the left lower chest, you will study it today in trauma. Important एक बात याद रख लो, whenever a patient has an injury in this junctional zone. What do I mean by junctional zone? जहाँ पे chest खत्म होती है और abdomen शुरू होता है. In this junctional zone, below the nipples usually, until the rib cage ends. In this zone, if there is any injury, we suspect chest as well as abdominal trauma. ठीक है, so you should not only investigate for a thoracic trauma, you should also investigate for a abdominal trauma if the injury is in this part of the junctional zone. यहाँ पे कहा है left lower chest में there is bruising. So which abdominal organ is at highest risk of injury? Very good, it is the spleen. We know in cases of blunt abdominal trauma or overall in cases of abdominal trauma, the most common abdominal organ injured will be your spleen. Where does the spleen lies? Spleen lies in the left hypochondriac region. ठीक है, so it lies in the left hypochondrium. तो अगर patient में यहाँ पे bruising है, there are higher chances that his spleen has been injured. And अगर spleen injure हो जाती है, क्या होगा? बहुत ज्यादा bleeding हो जाएगी. So there can be a intraperitoneal bleeding. Abdominal cavity में बहुत bleeding हो रही है. And उसका कारण क्या है फिर? वो कैसे suspect कर रहे हैं हम कि there's a lot of bleeding in this patient? His blood pressure is falling. What is normal blood pressure? 120 by 80, right? That is the normal one, exact one, average. ठीक है, यहाँ कितना है patient का blood pressure? It is 90 by 50 millimeters of mercury. So if the blood pressure is falling, will we say the patient is hemodynamically stable or hemodynamically unstable? So as the patient's blood pressure is falling, I will say that the patient is hemodynamically unstable. ठीक है, we'll study the flow charts today. But important thing is, please remember, in a case of any kind of abdominal trauma, whether it is a blunt abdominal trauma or a penetrating abdominal trauma, and the patient is hemodynamically stable or unstable, कुछ भी हो, in any four of the situations, always the first line investigation is what? always the first line investigation? Anybody? Hmm? It will be a fast, focused assessment by sonography in trauma. What is sonography? It is nothing else but the ultrasound itself. So using in the case of emergency, in the emergency room or in the operation theater, we are actually trying to place the ultrasound probe only at 4 places. हम बस 4 जगह पे देखेंगे. One is called as the subxiphoid pass. Second is called as the perihepatic pass. Third is called as the perisplenic pass. And fourth is called as the pelvic pass. हम क्या देखना चाहते हो? अल्ट्रासाउंड का दोस्त कौन होता है? हु इज अ फ्रेंड ऑफ अल्ट्रासाउंड? फ्लूइड इज अ फ्रेंड ऑफ अल्ट्रासाउंड. जहां जहां पानी होगा, किसी भी तरह का फ्लूइड होगा, वहां पे इन्वेस्टिगेशन ऑफ चॉइस इज यूजुअली अल्ट्रासाउंड. वेदर इट इज एब्सेस, ओके, वेदर इट इज एनी fluid collection, like it is hydrothorax, it is ascites, any kind of fluid collection, or it is hydrocele in the scrotum, the investigation of choice always is usually a ultrasound, except in one condition, that is hydrocephalus. In hydrocephalus, the investigation of choice is the NCCT head. Otherwise, in all fluid collection conditions, answer is always a ultrasound. No issues with this. तो याद रखना अल्ट्रासाउंड का दोस्त कौन है? तो फ्लूइड अल्ट्रासाउंड का दोस्त है. ठीक है. So here also we are trying to look for what? Here we are trying to look for, in a case of trauma, we are trying to look for any bleed. What is blood? Blood is a fluid again. So अगर bleeding होती है abdominal cavity में या फिर in the thoracic or in the pelvic cavity, we will try to look for any collection on the ultrasound. If that collection is seen, that means bleeding has occurred in the patient. तो अगर fast positive हो जाता है, then if it is a first line investigation in any kind of patient, whether he is hemodynamically stable or hemodynamically unstable, is always a fast, focused assessment by sonography in trauma. Because it is a rapid ultrasound, it is not a time taking procedure. It will be performed in a span of only 2 to 4 minutes. हम ज्यादा टाइम नहीं लेते हैं पेशेंट का. So even if he is hemodynamically unstable, we will not actually kill the patient, because at the same time usually the patient will be like we can get IV access in the patient, we can manage the airway of the patient at the same time. तो उसमें कोई दिक्कत नहीं आएगी. ठीक है. But in CCT, we will not send the patient if the patient is hemodynamically unstable. तो इसके बाद अगर वो पूछेंगे what is the best investigation or the gold standard investigation, then your answer is definitely CCT abdomen, contrast enhanced CT scan of abdomen, but that is only done in cases of hemodynamically stable patient. Is our patient hemodynamically stable? No, our patient is hemodynamically unstable. So CECT thorax and CECT abdomen, though it is considered as the best investigation overall, it cannot be performed in the emergency room. First, I have clearly mentioned it, used in the ER. And second, any which ways, as the patient is hemodynamically unstable, CECT is usually a time-taking procedure. It will almost take half an hour of the patient. And तुमने patient अंदर तो भेजा था मशीन के अंदर जिंदा, बाहर कैसे आया? वो मरा हुआ और पिट गए फिर उसके बाद. So that should not happen. Please remember, if the patient is hemodynamically unstable, don't send the patient for the CECT abdomen. ठीक है. Diagnostic peritoneal lavage was done earlier when fast was not available. Okay, because diagnostic peritoneal lavage is an invasive procedure. We'll study it in surgery. It is an invasive procedure. अगर fast available नहीं होता है, तो we actually aspirate some amount of blood. If there is blood in the peritoneum, जब तुम aspirate करोगे, blood आ जाएगा. That is what is the diagnostic peritoneal lavage. There is, ठीक है. So diagnostic peritoneal lavage is not performed nowadays. It was performed earlier. Fast was not available with us. अभी नहीं करते हैं. So Bailey and ATLS mention it. It is not performed nowadays. That's very important. ठीक है. X-ray chest and X-ray abdomen is the first line investigation I would have performed in the patient. मैंने first line पूछा है, मैंने best पूछा है overall. I have asked you the best investigation which can be done in the emergency room. X-ray will not tell you about fluid collection usually. ठीक है. Maybe it can tell you about some hemothorax, but it cannot tell you about any fluid collection in the abdomen of this patient usually. और यहाँ हम ज्यादा क्या suspect कर रहे हैं? There can be thoracic trauma, but more likely the patient is having a abdominal trauma. So abdominal trauma में usually X-ray cannot help you make the diagnosis. Therefore, it is only a first line investigation, not the best investigation overall. Therefore, in a case of unstable patient, it is always a fast which is performed, focused assessment by sonography in trauma, which is considered as the first line investigation as well as the investigation of choice in a hemodynamically unstable patient. तो अगर पेशेंट हेमोडायनेमिकली अनस्टेबल है, द फर्स्ट लाइन एज वेल एज द इन्वेस्टिगेशन ऑफ चॉइस, इवन द बेस्ट इन्वेस्टिगेशन इज ऑलवेज अ फास्ट. फास्ट में तो मैंने 4 ही प्लेसेस बताए थे. तो व्हाट इज दैट ई फास्ट और द एक्सटेंडेड फास्ट? So this extended fast mein, along with the 4 conventional passes, we also add 2 more passes. And what are these 2 passes for? 4 passes कौन से थे वापस? पेरिकार्डियक. सबसे पहले इट इज अ पेरिकार्डियक पास. क्या करते हो पेरिकार्डियक पास में? You look for cardiac tamponade in this patient. Second is the perihepatic pass. You look for any blood collection around the liver. Then third is the perisplenic pass. Look for any blood collection around the spleen. And fourth is the pelvic pass. Look for any blood collection in the pouch of Douglas, also known as the cul-de-sac. ठीक है. इसके अलावा if we are suspecting thoracic trauma in the patient, please go for a E fast or an extended fast where the ultrasound probe is also kept on the right and the left thoracic cavity as well to look for any blood collection in the right and left pleural cavity. And blood collection in pleural cavity will be called as, ब्लड को क्या बोलते हो? हीमो बोलते हो. प्लूरल कैविटी इज थोरैक्स, सो इट इज हीमोथोरैक्स. ठीक है. तो यू आर ट्राइंग टू रूल आउट हीमोथोरैक्स इन द पेशेंट with these 2 passes of the right and left thoracic cavity. ठीक है. चलो. And if the fast comes out to be positive, कब बोलोगे कि fast positive है? When there is some fluid collection seen ना, or on a fast. क्या होता है फ्लूइड कलेक्शन? कैसे दिखेगा अल्ट्रासाउंड पे? ब्लैक दिखेगा, व्हाइट दिखेगा? इट इज हाइपोइकोइक. फ्लूइड इज ऑलवेज हाइपोइकोइक और ब्लैक ऑन अल्ट्रासाउंड. याद रख लो ये बात. फ्लूइड इज ऑलवेज हाइपोइकोइक और ब्लैक ऑन अल्ट्रासाउंड. ओके. The ultrasound waves or the sound waves can easily pass via fluid and therefore they do not reflect it and therefore no hyperechoic echogenic area will be there. It is hypoechoic. Black color होगा fluid का. याद रखना है. ठीक है. 100 ml is considered as positive fast. कुछ books बोलती है more than 100 cc. Bailey says more than 50 to 100 cc is a fast positive, whereas other books and journals say more than 200 cc is a. Question number 3, if I talk about a 22-year-old male was brought with a road traffic accident to the emergency. On examination, his GCS is how much? E2V3M2. How much is the maximum GCS score? Maximum GCS score is definitely 15 and minimum is 3 because, and there are 3 responses which are checked on a Glasgow coma scale. E stands for the eye-opening response. B stands for the verbal response and M stands for the motor response. Single best parameter is the motor response. ठीक है. याद रख लो. तो यहाँ पे E2V3M2 है. कितना है टोटल GCS score? The GCS score of this patient is around 7. And I hope all of you are quite aware that we'll study again. याद रख लो, if the GCS is between 13 to 15, that is suggestive of a mild head injury. If the GCS score is between 9 to 12, that is suggestive of a moderate head injury. And if the GCS score is less than equal to 8, that is suggestive of a severe head injury. And यहाँ पे the score is less than equal to 8. That means the patient has sustained a severe head injury. ठीक है. He had no fractures and no hydrocephalus, no raised intracranial tension was noted. ठीक है. तो कुछ भी नहीं है patient को. और NCCT head was performed and it is found to be absolutely normal. ये देख सकते हो NCCT head में कोई भी दिक्कत दिख रही है तुम्हें? ज्यादा नहीं दिख रही, सब कुछ ठीक लग रहा है. So what is the likely diagnosis in this condition? So usually in this condition, when the patient's GCS is very low, okay, when the patient GCS is very low or the patient GCS is not improving, these are the 2 important things they will mention. And the third one, the patient is in coma. So either if the patient is in coma, the patient GCS is very poor, or if the patient GCS is not improving, okay, and the NCCT looks to be normal. Okay, what is the investigation of choice for head trauma? It is the NCCT head, non-contrast CT scan of head. So usually NCCT पे हम क्या देखना चाहते हैं? We are trying to see any, क्या देखते हो? Bleed, and bleed will appear white or black on NCCT. So usually it white on a CT. Acute bleed or acute hemorrhage appears white on a CT. याद है ना सब टाइप के इंट्राक्रेनियल हेमोरेज? इडली शेप तुम्हारा जो भी बाइकॉन्वेक्स, कॉन्केवो कॉन्वेक्स, ठीक है, ओपेसिटी इन द सिल्वियन फिशर, okay, or intraparenchymal hemorrhage. All of those look white, right? So that is suggestive of bleed in the patient. Okay, so यहाँ पे definitely there is no acute bleed which is seen in this patient. Okay, nor there is any black area. Okay, what is black, anybody? Ischemia is decreased blood supply, and ischemia की वजह से क्या हो जाएगा, इनफाक्ट हो जाएगा बाद में. ठीक है, so neither any areas is seen, so we can suspect a hemorrhage, nor any black area seen, so we can suspect a ischemia or an infarct in this patient. So it is neither a ischemia or an infarct in this patient. Out करूंगा मैं based on this NCCT. I will rule out, very good, extradural hemorrhage in the patient easily. ठीक है. Now, again, the NCCT looks normal. So definitely I will also rule the herniation of brain, okay, as well. Now, we are left with two options. याद रख लो, if the NCCT looks normal, but the patient's condition is not improving, or rather the patient's condition is worsening, it is due to which kind of injury? Here, what happens usually, there is a gray matter and there is a white matter. I hope all of you are quite aware. Now, at the gray matter, white matter junction, there are some axons. So this is gray matter, this is white matter, and there will be some neurons जिनके axons इसी junction में पड़ते हैं. क्या होगा? When there is a shearing force, when there is a shearing is nothing but a pulling. Okay, when there is a shearing force in this area at the gray matter white matter junction, there will be stretch over these axons, and as there is stretch over these axons are going to damage. These axons will damage, and that causes axonal injury, not only in some part of the brain, but rather in all parts of the brain at all the white and gray matter junction. This is what is called as diffuse axonal injury. And here the characteristic diagnosis is DAI. Most severe form of brain injury, answer is diffuse axonal injury. यहाँ पे it is the most severe form of brain injury, and it has the worst prognosis among all brain injuries. Don't worry, we will study it in surgery. Okay, so that's the important funda. कोई दिक्कत नहीं है. Now if the NCCT, हाँ बोलो. So I'll come to that. आगे है ring enhancing lesions. I'll talk about that. ठीक है. Now important is, please remember, usually in a case of diffuse axonal injury, it is the most severe form of injury. यहाँ पे NCCT तो normal है. Then what should be the investigation? Very good. Usually अगर NCCT normal है, and for brain tissue, spinal cord tissue, or any kind of neural tissue in the body, the investigation of choice is a MRI, magnetic resonance imaging. So if I talk about the investigation of choice in DAI, it is definitely MRI. Usually which MRI? It is a T2 weighted MRI, because on a T2 weighted MRI the water appears white. ये दो W ऐसे याद रख लो. Water appears white on a T2 weighted MRI, and water appears black on a T1 weighted MRI. That's the basic idea. ठीक है. So water appears white. और ये क्या दिख रहा है? Water मतलब any kind of fluid. Usually it can be a blood also. So here you are able to see some blood at the gray matter and the white matter junction. These are very small bleeding spots which are seen. Therefore, on MRI, in a case of diffuse axonal injury, I am able to see which kind of hemorrhages. I am able to see punctate hemorrhages at the gray matter, white matter junction throughout the brain of this patient. So, याद रख लो, इसके लिए usually there is no such treatment in the patient. ठीक है? I hope all of you have heard about the F1 Formula racer, Michael Schumacher. वो अभी भी इसी condition में, and due to this reason. Okay, he has sustained a diffuse axonal injury. He was the topmost F1 Formula racer. Okay, but his wife is used, that there is also a documentary made on his life as well. ठीक है, जहां पर उसकी wife बता रही कि it is so much difficult to manage him. Okay, if I talk about intracranial hemorrhages, okay, in cases of intracranial hemorrhages, the first hemorrhage where first of all, intracranial hemorrhages, what is the investigation of choice? NCCT head. Rather, NCCT head is not only the investigation of choice in any intracranial hemorrhage, it is the investigation of head trauma or head injury. Okay? Now, NCCT head shows a black area. Black means the word echo is used for ultrasound. The word density is used for CT, and the word intensity is used for MRI. Okay? Anything appears black on ultrasound, it is hypoechoic. Anything appears white on ultrasound, it is hyperechoic. Anything appears black on a CT, it is hypodense. Anything appears white on a CT, it is hyperdense. Anything appears black on a MRI, it is hypointense. anything appears white on MRI, it is hyper intense. कोई दिक्कत नहीं है. So if there are black areas on a CT scan, that is suggestive of hypodensity, and if there is any white areas on a CT scan, that is suggestive of hyperdensity. Now what is the cause? Tell me jaldi se. Hypodensity के cause is usually a ischemia or hyperdensity की cause is generally hemorrhage. This NCCT head shows which kind of a hemorrhage, which shape of hemorrhage. It is usually a biconvex hemorrhage, or it looks like which shape? अरे इडली मत याद रख लो रे मेरे बाप, वो एग्जाम में नहीं देने वाला, समझने के लिए ठीक है. इट इज बाइकॉन्वेक्स और लेंस शेप्ड हेमोरेज. ठीक है, लेंटिकुलर शेप भी बोल सकते हो, या वो टर्म यूज करेंगे दूसरा लैंसेट हेमोरेज, एंड दैट हैज बीन द टर्म व्हिच हैज बीन यूज्ड ऑलरेडी. ठीक है, तो लैंसेट इज नथिंग बट अ लेंस लाइक हेमोरेज. ठीक है, usually biconvex, lens shaped, lenticular or a lancet hemorrhage is usually a feature seen in extradural hemorrhage. Which is the most common vessel to bleed in EDH? Middle meningeal artery. ठीक है, चलो. Next one. Here you can see a opacity. Which shape opacity is seen? एक साइड में कॉनकेव है और दूसरे साइड में कॉन्वेक्स है. ठीक है, so this side is concave and this side is convex. So या कैसे दिख रही है? Very good. It is like a crescent shaped opacity. What is a crescent? Nothing. Half moon shaped opacity is generally seen. ठीक है, that is what suggestive of that is what is suggestive of subdural hemorrhage, SDH. Next, here you can see opacity is where? Opacity is in the ventricles, and it is also seen in the sylvian fissure. So if the opacity or the hyperdensity, to be specific in CT, it is called as hyperdensity, na, white areas. So if there is any hyperdensity in the sylvian fissure or in the ventricle, that is suggestive of bleeding in with space. That is suggestive of bleeding in subarachnoid space, where there is normally which fluid present? CSF is present normally over here. CSF appears black because it is a clear fluid, but as blood goes into it, now it becomes radio opaque and it will appear as white or hyperdense on a CT scan. ठीक है, तो याद रख लो subarachnoid hemorrhage. किस टाइप का हेडेक होता है फीमेल में? It is usually a worst headache of my life, also referred to as thunderclap headache. ठीक है, next, this here you can see this hyperdensity or this opacity कहाँ पे? Within the parenchyma, usually in the basal ganglia. The most common site in the basal ganglia is definitely the putamen, which is the most common site for which kind of a hemorrhage? Intracerebral hemorrhage. Don't call it a intracranial because all four types are intracranial hemorrhages only. दो चारों के चारों cranium के अंदर ही हो रहा है. This is intracerebral, which occurs within the cerebral or the brain parenchyma or the tissue. ठीक है, तो ये intracerebral या intraparenchymal hemorrhage है. No issues with this anybody? So these are the important ones. ठीक है, बाकी चीजें इनके लिए मैं already medicine में discuss कर चुका हूँ. We'll discuss in surgery. Question number 4 now. A 13-year-old child who has history of chronic right ear discharge presents with headache, fever, and altered sensorium. MRI was done and it has been given below. What is the diagnosis? What is your provisional diagnosis? Anybody? पहले क्या हुआ था? Leave behind the unsafe CSOM. हाँ, so speak louder, confident रहो. Okay, correct answer है. It is unsafe CSOM in the patient. Very good. ठीक है, ENT पढ़ी है तुम सब लोगों ने. अरे आ रहा हूं उस पे, रुको. Provisional diagnosis मतलब we were suspecting in this patient initially कि the patient might have suffered a unsafe CSOM. क्यों unsafe CSOM? Because the patient was having a chronic right ear discharge. Usually, if there is a chronic right ear discharge, it is actually the infection of the middle ear known as chronic suppurative otitis media. Suppuration का मतलब ये होता है pus forming infection. ठीक है, it is chronic. But now unsafe क्यों बोला हमने? Because from there the infection has spread to the adjacent areas also. हमने ENT में already पढ़ा था. Middle ear से infection कहाँ जा सकता है? ऊपर जा सकता है, पीछे जा सकता है, नीचे जा सकता है. ऊपर जाएगा तो कहाँ spread होगा? हाँ, very good. If it goes above the roof of the middle ear, it will spread into the meninges first of all, causing meningitis in the patient. Second, it can also cause pus collection outside the meninges, and outermost meninges known as outermost meninge, सबसे बाहर वाली meninge, dura mater. So if there is pus collection outside the dura mater, that will be called as extradural abscess. Then there can be pus collection beneath the dura mater. Dura mater के नीचे pus collection हो जाएगा, and that is what is called as subdural abscess, or it can be called as subdural empyema. That is one and the same thing, collection of pus. ठीक है? Then from there it can spread to the brain as well. And brain में क्या हो जाएगा? There can be a pus collection in the brain called as a brain abscess usually. Which lobe lies above the ear? It is the temporal lobe of the brain. So most common site for an autogenic brain abscess. Autogenic is what? Autogenic का मतलब क्या है? Due to ear. Okay, due to ear if the patient is having brain abscess due to some ear infection. That is